How does your local hospital stack up when you look at its Google review scores? Yes, across Canada, people routinely leave Google review scores when they go to a restaurant or maybe they get their car fixed at a garage or some kind of other activity. But people are also leaving Google review scores for hospitals. And for the second time now, our think tank sat down and analyzed the data for major hospitals across the country. And my co-author on the report, Bacchus Barua, who's our research director at our think tank, secondstreet.org, he joins me today to walk us through some of the findings. Bacchus, thank you for taking a few minutes to chat about this report. I wonder if you could maybe just tell us a little bit about the process for looking into this type of research.
Well, thanks for having me on the show again, Colin. I think it's pretty obvious that the ultimate goal of any healthcare system is to serve their patients, and therefore it's really important to listen to what these patients are having to say about how well that system is serving them. Now, this is usually done through surveys, which are really, really, really important. We do a lot of them too. But it turns out a lot of patients actually do leave Google reviews for the hospitals after they get treatment or somebody who they know received treatment over there. Unfortunately, overall, the news isn't really that good. We looked at hospitals across Canada. We tried to look at the largest hospitals that we could find based on the number of beds, ensuring provincial variation, and we were only looking at hospitals that had at least 30 Google reviews. And we found that the average score was just 2.88 stars out of 5. And that's not including the fact that on Google, you're actually not able to give a 0-star review. So I think, there's really a lot of room for improvement, is what patients are having to tell us from this report.
Yeah, I actually found it was interesting comparing the numbers this year versus last year, down a little bit. Not a huge drop, but seeing it go down. That's not the direction we want to go in, obviously. I wonder if you could maybe walk us through maybe some of the top performers in the country, and then we'll go through some of the ones that didn't do as well.
Well, that's right, Colin. The score this year of 2.88 was slightly lower than last year of 2.91. Given that this is really a small range, although that seems small, it's really important about telling us what direction this is moving, and that's not the direction that you want it to go, even if it looks small on paper. I do have a list over here of the top performers and the lowest performers. Right at the top, we have Mount St. Joseph Hospital in BC. That was also a top performer last year. And Mount Sinai Hospital came in at rank 2. Why I kind of grouped these together is that these were the only two hospitals that actually managed to achieve 4 out of 5 stars. Every other hospital was below 4 out of 5 stars. We then have the Centre Hospitalier Régional de Trois-Rivières in Quebec at 3.85 stars, IWK Health Centre in Nova Scotia at 3.81 stars, and St. Michael's in Ontario at about 3.66. On the flip side, at the bottom, some of the worst performers this year was the Moncton Hospital in New Brunswick, 2.24, Windsor Regional Hospital, the Metropolitan Campus in Ontario, 2.23, Niagara Health Centre, the Maroda Family Hospital in Ontario, 2.21, St. John's Regional Hospital in New Brunswick, 1.96, and Seven Oaks General Hospital in Manitoba, 1.64. Again, those two hospitals at the bottom are the only two hospitals that scored below 2. So this is really telling us about the sort of breadth of performance that we see between these 84 hospitals in Canada.
Yeah. Seven Oaks and Manitoba, I mean, that's pretty staggering. 1.64. I mean, that's really bad service there. What about if you look at, we got about a minute left here before the commercial break, but if you look at things on a provincial basis, any thoughts on or analysis there in terms of, where different provinces rank?
Yeah, we did try to look at the total average in any particular province. Of course, we have a different number of hospitals in each province, but we do see British Columbia and
Mhm.
Quebec sort of ranking towards the top, scoring over 3. And then at the bottom, we have Manitoba and New Brunswick at about 7 or 8. Two provinces we left out because they didn't have enough hospitals in that ranking. But I would say over here that even when we look at the difference between the top province versus the bottom province, there's only probably about maybe a 0.5-star difference between them. So it's not that significant, but we definitely probably want to look at what BC and Ontario are doing. Sorry, BC and Quebec are doing differently compared to Manitoba and New Brunswick.
Right. Yeah, even with 3 stars. I mean, that's not that good. People often look for another restaurant if you see it's got 3 stars. But anyway, we'll be back in just a moment. We'll continue to talk about the reviews. Then we're going to bring in Nadeem Esmail from the Fraser Institute. We're going to have a discussion about how we actually get performance up in hospitals right across the country. We'll be back in just a moment. And we're back on 2nd Street chatting about hospital Google review scores across the country. We're chatting with my colleague Bacchus Barua, who's a research director at our think tank, secondstreet.org. Bacchus, I want to chat with you. I mean, something that's important, I think, to assess is not just how hospitals are performing now, but where they were. Like, are they actually improving? Are they declining? Can you walk us through maybe some of the top improvements that we saw in the country?
That's right. I mean, this is a great scorecard in a way for hospitals really to get an understanding of how they are doing compared to themselves. It's one thing to rank compared to other provinces, but using yourself as a comparison is also important. We do see the Health Sciences Center in Winnipeg as being the most improved hospital compared to last year. They improved almost a full star, 0.97 technically. And then on the flip side, we also see where the greatest deteriorations are. And this year we saw it with St. John Regional Hospital, which was amongst the bottom ranked hospitals. But it actually fell about 1.35 stars compared to the previous year. So the one other kind of interesting thing in terms of improvement, year by year, is that the hospital that performed really, really at the bottom last year, Surrey Memorial, actually performed a little bit better this year. Just a really good way to try and understand how things are changing year to year.
Yeah, I think you're right. It's important to understand sort of how you're comparing with yourself, because if you are an underperforming one, especially, and you're trying to improve and you're making changes, you want to assess if things are going in the right direction, so you keep going in that direction. Why don't we shift gears a little bit here and talk about the comments? Nearly 9,000 comments that we analyzed. Can you give us sort of an overview of what people are saying about the service that they're receiving at these hospitals across the country?
That's right. I mean, this is really built up through patient experiences, and we have about 9,000 comments that went into building this report. I would say, just like last year, one of the clearest trends that we see is that wait times are a significant factor, particularly when we look at wait times related to a negative experience in the hospital. This could be, long waits for, in the emergency room, instances where patients might have gone in feeling okay, but it went so bad because of how long they had to wait that, previously treatable conditions suddenly became an emergency and a crisis. And really folks who actually felt that, their loved ones may have actually been saved if they had actually been treated on time. And I think this is probably quite, unfortunately unsurprising, given what most people are now coming to understand about the reality of Canada's healthcare system. There were also a lot of comments about, potentially substandard care and leading to, again, avoidable deaths. And I would say those are, kind of two of the main themes. That being said, there are, of course, some examples of folks who had good experiences as well, did receive timely care, and are very grateful for the treatment that they receive in the healthcare system. But overall, given the score that we see, 2.88 out of 5, I think you can guess what the overall trend was telling us about the negative sentiment about experiences in these hospitals.
Yeah. No, and that's a good point, is that, you've got every day thousands of experiences that people are having with the healthcare system. I mean, they're not all bad. I mean, it was nice to see people give a shout out when a staff person or maybe a unit in a hospital went above and beyond to provide care. When you went through this exercise, you're reading the comments, you're looking at the number of stars that hospitals are getting, the changes and so forth, everything taken into account. Were there any surprises for you?
Well, I think the first thing, just circling back to the comments, is that a lot of patients are, I think, now well aware of the general status of the healthcare system, which is a sharp change from, what we're told about, Canadians being very proud of our healthcare system. I think it's more that maybe they're afraid of other things in reform, and our pride in the reality of what's on the ground is starting to change. And this was really driven home by one comment, for example, where a patient in New Brunswick had to wait 14 hours in the emergency room. And they just said straight up that
Hmm.
it would be quicker to fly to South America or Europe and receive treatment. And we're also understanding, better understanding that this is not the case and this should not be acceptable based on other countries with universal healthcare. So I think that was a big theme that I think Canadians understand that this is not right, it's not sustainable, and it doesn't have to be this way. But the other theme I think that was surprising was just seeing some of those hospitals actually improving compared to last year. Like I mentioned with Surrey Memorial, even though they're still in the bottom 70s, they have seen improvement, which means that it's possible. And that I think just goes to one of the themes that we may talk about. That one of the strengths of this report is that hospitals that are not doing really really well can learn from other hospitals that are doing well if they understand what the problem is, and that's what this report is trying to do.
Yeah, very good point. Okay, when we come back, we're going to be talking about solutions. How can we get the patient experience better right across the country when you visit a hospital? We'll be back in just a moment. And we're back on 2nd Street chatting about hospitals, how we can fix them, their Google review scores. Nadeem Esmail joins us from the Fraser Institute. He's their Director of Health Policy. Nadeem, I know you're familiar with this report. I mean, there's nothing really, I would say, earth-shattering when you look at the overall situation. I mean, it shows, once again, with another tool, that Canadians have serious concerns about the care that they're receiving in hospitals. This is actually pretty well known. But I'm curious from your perspective, if somebody said to you, what's the number one thing that the government could do to really improve the type of hospital care that Canadians can get in this country, what would be your advice to them?
Change the way the money moves. Right now, a hospital gets every patient through the door as a drain on their annual budget. They're given a great big bag of money every year and told to look after people. And that means shorter ED times, faster throughput for patients, more surgeries just drains the budget. If we had money following patients to the hospital door the way they do across Europe throughout the developed world, we would get much more hospital care for this from the same resources and shorter waiting times. The evidence is very clear on this. So just change the way we pay for hospital care. And then the next step beyond that is allow some private operators in. Let's get some competition into that hospital sector. We've seen from Sweden, from Australia, from other countries. This is yet another enhancement in getting good access to universally accessible emergency care.
Okay, Bacchus, same question to you. If somebody, says to you, what's the number one thing we can do to improve hospital care in this country, what would your recommendation be?
Well, I'd very much agree with Nadeem, which I guess is not surprising because Nadeem and I have worked for a long time together. But I think it's important to really underscore the point of why this matters. And that's, when you change the type of funding, it connects it to the actual activity that's performed in the hospital. And two things happen at least.
Hmm.
One of them is that you get a lot more transparency. And so you're starting to move away from, potential wastage in that hospital. And the second thing is you start to get a sense of competition, particularly if you start to have other private hospital operators in, so that if a hospital is doing really, really well, it's treating a lot more patients and doing a good job, they actually start to receive funds to treat that patient. The one other thing that I would say, though, that's maybe related to our report over here is that it does give us an opportunity to learn from hospitals that are doing better. So, hospitals that are not doing so good, get on the horn, talk to somebody like Mount St. Joseph and try to understand what do they do differently so that they can improve.
Hmm. Nadeem, I want to get your take. So if we're talking the types of changes that you've recommended, and Bacchus just echoed what you're saying, would that address both, I'll say these two major problems, long waits for care in an ER, but also for surgeries, because we hear that too. But those changes that affect both of those types of services that people receive from hospitals.
Absolutely. Canadians might be surprised to learn how often operating rooms are actually closed in Canada, in spite of the fact that we have hundreds of thousands of Canadians on waiting lists, with some of the longest waiting lists for care in the developed world. We have ORs closed evenings, weekends, summer slowdowns, holiday slowdowns, because again, the way we pay for hospital care is every additional surgery drains the hospital's
Yeah.
budget. We've got to start having money follow patients to the hospital so that opening that OR in the evening means more resources for the hospital. If hospitals are earning more money for caring for more patients appropriately and in a positive fashion, they're going to treat more patients. We're going to get shorter wait times without increasing the number of resources we have. I mean, we know we don't have enough hospital capacity or enough surgeons as a result of past government decision making, but we can make much better use of the limited resources we do have. All we got to do is have the money follow the patients. That's the big first step. And then again, and I think Bacchus made this point well, having that private competition enter, having providers who are highly incentivized by money flows enter this system and compete with the public hospitals brings the level up at all hospitals for all patients.
Bacchus, we've only got about 30 seconds here, but do you think providers from outside of Canada would want to enter this market?
Not the way that it currently exists because of the restrictions that are imposed by the Canada Health Act and including with provincial legislation. So I think a lot of things need to be changed at our government level so that it could actually attract them. But I think that is not the reason why it should stop. The answer there is therefore that we need to change those rules and regulations so that we can attract providers so that we're not sending our patients away in order to get care, but rather getting providers in to treat patients over here.
Okay, listen, we got to take a commercial break. When we come back, we're going to keep plowing away at how we can actually improve the care in hospitals in this country. We'll be back in just a moment. And we're back on Second Street talking about how we can improve the type of hospital care that Canadians are receiving coast to coast. Gentlemen, we've been talking about the Google review scores that we analyzed. I mean, when you go through the comments, and anyone can go online to a hospital and read them, you will, you'll see some positive comments, people glowing about certain staff, different departments, and then you often see people that aren't so happy about things. Maybe even criticizing how staff treated them directly. Obviously, we don't want to hear about that type of experience in the healthcare system. So, what can you do to improve customer service that patients are receiving when they walk into a hospital? Nadeem, I'll ask you if you could go first with this one.
Well, I think there are two sides. The first is when you have competition, when you have a consumer focus, when patients are bringing money to the door, the provider is incentivized to treat them better, to treat them well. We know this from all other aspects of our lives where there's good competition and we're paying for services, the providers are interested in us. And that's what we got to change at the hospital level. I think equally, though, when hospitals run better as a result of these changes, when there is competition, the people working there are happier. I mean, we have great healthcare workers in this country who are working very hard and doing their best in a very broken system that is burning them out, that is frustrating them. For that triage nurse, when you come in, they know they have nowhere to send you. And so they're just as frustrated sometimes as the patient. And unfortunately, I think sometimes that ends up on the patient's lap, where really the issue is governments have made very poor policy decisions that are creating this problem. That's what we need to fix.
Yeah, and often when I talk with people in the healthcare system, they're frustrated. They got into it because they want to help patients, and often they just find it's like a chaotic environment. And I can understand why sometimes maybe they're short on patience for people. They're short on patience for patients, I should say. Bacchus, same question to you. What are your thoughts on how you actually improve that customer service experience that patients are receiving when they go into Canadian hospitals?
Yeah, I'd agree with incentivization and competition and essentially also rewarding. So it's not really just about not having funds or negative rewards, but it's also about positively rewarding hospitals that are doing well. But I think the second point that Nadeem brought up is really, really important. And I think that the Google reviews that we've done, while they are at a hospital level, they're really an indictment of the system as a whole and the way that governments are doing and are performing. And the tools and the resources that governments are providing our healthcare providers with. We know that our healthcare providers are doing everything that they can. We know that a lot of them are burnt out and as frustrated with the system. So I really see these reviews as a review of our healthcare system, and it's not a very good one. One thing I would say, though, is that, while this is looking at hospitals in the emergency department largely, we are seeing pressure points at every point in the system, when it's coming to being able to receive after-hours care, walk-in clinics. That's why a lot of patients actually end up in the emergency department, and the emergency departments are getting overloaded. And on the flip side, because patients are actually not being able to get treatment and surgery, again, that's why they might end up at the emergency department, because they've been waiting a long time to see their specialist or waiting for a condition that would have been treatable by a specialist over there. So Emergency rooms, I would have always said, were really the last bastion of defense for our healthcare system. We talked a lot about long wait times for treatment, but now that we're seeing this over here and at the hospital level, I think it's really, really concerning, and doctors themselves are concerned about it too.
Mm-hmm. That's a good point. Good points to consider there. Nadeem, final question to you. We've only got about 35 seconds here, but what about the issue of staffing shortages? I mean, we hear this come up, and you can understand how you're not going to get good care if staff are run off your feet. Any thoughts on that one?
I think we have to understand where the staffing shortages came from. These are, in many cases, deliberate decisions by government to not train enough physicians, to not train enough providers. We need to get government out of the way. We need to make better use of the professionals we have now. And I think by shifting incentives and allowing doctors to work to their fullest, having hospitals open ORs in the evenings and weekends, we can get a lot more from what we have now. Alberta is also doing something great by allowing providers to do private time as well as their public service. So I think there's some options available to make better use of resources while we train more up.
Okay. Gentlemen, thank you for your time today. This is obviously an important issue, and appreciate your thoughts on this.
Thank you.
Thanks for having us.
As always, thanks for joining us, and we hope you'll consider sending us some feedback.